Hamartoma of the lung. This is a patient who was subjected to a CT-guided biopsy of a central, well-defined, rounded lesion, and this is the histology. The histology shows lots of chondrocytes, which are the basic constituents of cartilage. Here's a ground glass matrix, which is eosinophilic. So this essentially is cartilage from the biopsy. Now, if you look carefully at the lesion, you can see some low attenuation areas and an area of calcification. If you subject this lesion to pixel densitometry, so for example that voxel of tissue returns lots of negative values within that box, and so this indicates that there's fat in the lesion. And if there's fat in the lesion, you can be sure that this is likely to be a hamartoma. Now, this particular hamartoma obviously contains fat, calcification and cartilage. Here's a different example in a patient who has got popcorn calcification, which is really quite evident. They also have low attenuation areas, which is due to fat. So fat, cartilage, calcium and soft tissue equals hamartoma. Don't forget that hamartomas are still allowed to grow, they're just not allowed to grow excessively. So they can mimic neoplasms, but when you detect fat, you can be sure that if you have other constituents, you're dealing with a hamartoma.